closed captioning provided by Beaufort County.
All right, the 2 o'clock, November the 3rd, Community Service Committee meeting is now in session. If I could, get everybody to rise for the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. And Ashley, this has been published and posted, subject to FOIA?
Yes, sir.
All right, thank you. Now can we get the approval of the agenda?
I'll make the motion to approve the agenda.
All right, and Mr. Reitz seconded that. Moving into the public comment period. Do we have anybody signed up?
No, sir.
All right, is there anybody in the audience that would like to make a comment? Seeing none, I will close the public comment section. And moving into item 6, the Assistant County Administrator report. Welcome.
Good afternoon, Chairman and committee members. Today, my report, I have asked Rebecca Witt, the Director of Alcohol and Drug, to give an update on the South Carolina opioid settlement funds. She's here to share what they have done with those funds as far as programs, projects, and the outcomes of some of those. Rebecca?
Thank you for being here.
Thank you for the opportunity.
Wow.
It's electric. It shocked me.
We're starting
It's
that now, so you guys
electrifying.
watch that.
Absolutely. Well, thank you so much for the opportunity to be here with you this afternoon to share a little bit about the strategies that we are using here in Beaufort County to address the opioid crisis. This is a crisis that continues to impact our families, our communities, not only here in Beaufort County, but across the state and across this nation. Today, I'm going to specifically talk about the strategies made possible through funding from the South Carolina Opioid Recovery Fund Board. This was established as the result of a statewide lawsuit against pharmaceutical companies. These funds are not grants. They are not derived from taxpayers' dollars. Instead, these are guaranteed political sub-funds that are allocated to counties and municipalities to support opioid abatement efforts. This is an important distinction to make. It ensures that we have a dedicated and sustained effort to invest in prevention, treatment, recovery initiatives across our communities for many years to come. Our approach is comprehensive. It is also community-centered. It focuses on those 3 areas of prevention, treatment, and strategic planning. So starting with prevention, it's our most important strategy, I believe, because we want to stop substance misuse, opioid misuse before it even begins. This is a very powerful tool. So our first prevention strategy is, of course, increasing access to life-saving naloxone, aka brand Narcan is one of the brands. There are several. It's a life-saving nasal spray that helps people to survive an overdose or a poisoning experience so that they can get medical attention. We have placed free vending machine in the county detention center already. People can go in there and retrieve free Narcan anytime the detention center lobby is open. And we also are about to expand this by placing a vending machine in the lobby of the Human Services Building, also known as the DSS building, across the street on Duke Street. We will also place Narcan vending boxes at all 6 library locations across the county so that the public in high traffic areas can access free Narcan at all times. We also provide community education. We have an opioid prevention coordinator full-time who leads outreach events in partnership with organizations like the United Way's Showers of Dignity shower trailer and partnering with Coastal Empire Mental Health Center's Highway to Hope RV for mental health services. We also host pop-up events. We have a community response vehicle that's dedicated to popping up in places on OD map where we're seeing hot spots across the county where overdoses or suspected overdoses are occurring. And we also provide scheduled presentations, prevention education at community organizations like senior centers, schools, technical colleges, and of course USCB. Social media plays a big role in this prevention effort as well. We use social media in a very positive way to raise awareness about the risks of opioid misuse and access to naloxone. We believe everyone should have naloxone in their first aid kit so that they can save a life. Our media campaigns also focus our public service announcements on some of the Palmetto Breeze buses, so people can scan a QR code, see the phone number there, and know where to get help. We have PSAs on streaming audio platforms such as Spotify and Apple Music, and on video platforms like Roku, Fire TV Stick, and Apple TV. Additionally, we use geofencing messages to target mobile devices in high-risk areas. Have you ever wondered why you're in a store and you get a certain pop-up ad on your phone or a coupon? That's the result of a product called geofencing. So we place geofencing ads in high-risk areas to target opioid misuse or opioid poisoning and let people know about access to help. We also tackle the issue of unused opioid medications by distributing free drug disposal bags, kits, to reduce the chance of access to medications or opioid misuse. And we also support the coroner's office in Beaufort County. We provide toxicology testing kits that are quantitative that will tell them in real time within 30 minutes of doing a blood test if there was enough of a specific substance in the person's system to result in a fatality. And we can have access to pretty much where that occurred within a geographical area so that we can go out and do community response, especially if we're seeing spikes in overdoses in a certain location in the county. So that's our prevention efforts. And we also, of course, have treatment efforts because we need strong pathways to treatment for people who are already impacted by opioid use disorders. We are working with our incarcerated population who are high risk. Our inmates in the detention center have access to a full assessment with a certified alcohol and drug counselor. And thereafter, they can participate in 10 group education sessions with that addiction counselor. We are expanding that effort currently by placing a peer support specialist who is a person in long-term recovery alongside that counselor in the detention center so that they can connect people to recovery resources and help them plan for their transition back into the community upon reentry. We also, in the community, provide medication-assisted treatment and support services to people who have no insurance, to people who have insurance but can't afford the cost of care, regardless of their ability to pay. They can meet with a counselor in person in Beaufort or Bluffton in our 2 offices, and we've also implemented telemedicine, so they can meet with a licensed addiction counselor no matter where they are. We're also expanding access to care by embedding a counselor and a peer support specialist in our partner clinics, where they can work alongside physicians and mental health providers. This is a very integrated care approach. It ensures that people get the help they need, the type of help they need, and they get it where they need it. We also are looking at strategic planning. We want to make sure that our efforts are effective and sustainable. We're committed to a contract with Schools of Public Health that will help us develop a comprehensive needs assessment for Beaufort County. This will include a comprehensive in-depth review of our data, in-depth interviews with key stakeholders, community organizations, partners, citizens, and the like, to map our existing resources and to identify the gaps in resources in Beaufort County. The goal is to target root causes of substance use and overdose and to understand which of our populations are most at risk here. These findings from this community needs assessment will result in recommendations that will inform our future planning and enable us to submit strong targeted applications for SCORE funding. This is about building a long-term, data-informed strategy that meets the real needs of our communities here in Beaufort County. So just to close, our work in Beaufort County is grounded in compassion. It is collaborative, and it is evidence-based. Effective prevention and treatment of opioid use contribute to the overall health, the safety, and the well-being of all of our community members. And I want to thank all of you here for your continued support, because healing in our community is not something that any one of us can do alone. It takes all of us working together to bring the hope, the healing, and the lasting changes. And every day I have the privilege to serve the people of Beaufort County. I get to witness another chance at life, to see them recover, to heal, to become healthy and productive members of our communities. And that's what this work is all about. Thank you. And how may I address your questions?
I'll tell you, thank you for that report. Open it up to questions now. Yes, Allison.
Can you tell us a little bit more about the pop-up, how that works?
Okay, great question. With the overdose map, it's populated by EMS when they go out to a suspected overdose. It's pretty much just a dot on the map. And until it's confirmed, of course, it's just a suspected overdose. When we see those dots popping up, we can get things called a spike alert on the OD map. And that spike alert will tell us, hey, you need to pay attention. There's something going on in this area. And so with that, we can go into that area, and we have the SUV. We can set up a table. We have the ability to provide free Narcan on the spot. We also have the ability to do a brief screening and a referral to treatment services, mobile access in the community on the ground. And so we let people know about those pop-ups. Sometimes they see it when they're driving by, but we also advertise that on our social media so that they know, hey, tomorrow, if I need Narcan or I need help, I can go to that spot and I can get it.
Go all over the county.
Yes, ma'am.
Everywhere.
Everywhere, all over the county. And that's driven by our opioid prevention coordinator, and we're working to also take out peer support specialists, people in recovery, to accompany them. So there's always somebody in recovery there to encourage. And I can tell you that we've had success stories already in a short time. Just one last week, a gentleman that contact was made at a pop-up event and was a little bit reluctant at the time to get help. But they were able to receive our information, and last week they called, and within minutes we had them scheduled to come into the office for an appointment.
That's fantastic. Yes.
Just one quick thank you. Great work. I can't help but think about strategic partners. What are you doing with our high schools? And I'm sure but just to let everybody know that.
Absolutely. We have partnerships with all of with the Beaufort County School District. We go out and we have not only the opioid prevention specialists, but we have a total of 5 full-time certified preventionists in the department at Nexus Care. They cover the entire county, both public schools and private schools, and they do presentations. And last week, you may have seen our huge success with Red Ribbon campaign. We had a social media campaign, and we had a lot of participation from county departments and employees as well as citizens in that, people of all ages, to talk about prevention. So we do go into our public and private schools to provide prevention education pretty much on any variety of topics that they need. Not only opioid prevention, but it could be alcohol, marijuana, tobacco, vaping, all of the above.
Yeah. Thank you. Very nice.
Thank you. So
it occurs to me that we also have to deal with a population that is transient, whether they're coming from another county or outside our state. They come in here, vacation, whatever. How do we handle those people?
Well, that's a great question as well. We do sometimes have transient people, and even some of our own citizens, I would say, are transient between counties. They're here, and tomorrow they might be in one of our surrounding counties or another part of the state. So we're part of a large network. We don't exist all by ourselves at Nexus Care of Beaufort County. We're part of the Behavioral Health Services Association of South Carolina, in which there are a total of 31 county alcohol and drug commissions. And we also have many partnerships with private organizations across the state of South Carolina that we can conduct outreach to them. So if person needs help, they come through our door and they're not from here, they're from another county, we can reach out across the state and coordinate help, no matter where a person is from.
Okay, thank you.
And York.
Yes, quickly, I appreciate the report and your approach in dealing with this problem. One question I have is, have you noticed the reduction in numbers of opioid patients? And the other question I have is, a lot of your funding is outside funds. Maintaining this program in the future, I'm hoping that through your strategic planning that you would put the organization, use all the resources you can right now, but eventually not have a need for all those resources and stuff, but sort of maintaining the program in the future. And the reason I'm saying that, asking that, is that concerned about that is because I don't want your program to be an effective program and then it dies because of the lack of resources from the outside. But locally, we may not be able to sustain that effort. So it's almost like putting yourself in a position to address the problem, but weed yourself off of the problem. Yeah, so that's a comment, a statement. If you want to comment on it, go ahead.
Thank you for that. It's always an issue of sustainability of programming. And I had the opportunity to speak with the program administrator of the SCORF board just last week at a BHSA meeting with all the directors across the state. Currently, SCORF has adequate funding, especially after the recent settled the last piece of the settlement with Purdue Pharma and the Sackler family, to sustain programming until 2041 for opioid abatement initiatives in South Carolina. So on the one hand, Mr. Glover, the funding is going to be secure for many years to come. And at the same time, that funding is only meant to increase capacity. It's never meant to replace our current projects or our current funding. It's only meant to expand capacity. And part of that is looking at, I hope that by 2041, we don't have to have as much programming directed at opioid abatement if we've done our jobs well. But we know addiction is something that can, that's always going to be present. So we will be looking at, in the long term, having programming that we can sustain, not just to address opioid use, but to also address substance use of all kinds.
Okay, thank you.
Thank you.
Thank you. Are any other questions? I do have one. The Myrtle Park location, are y'all planning on expanding the vending machines? And I was thinking Myrtle Park is Department of Public Health is there.
They are there, but we would like to have a distribution box 24 hours a day. So this can go kind of like a newspaper stand, and it's weighted down so it won't blow away in a hurricane. And it can be outside the building, access 24 hours a day, 7 days a week, so that even when nobody's there at DPH or at Nexus Care, that they have access to it there. And some of the boxes, sir, are also, they're portable. that's what we like about those. Vending machines you can't pick them up and move them. But these boxes are just like a newspaper box, and you can pick them up and move them to another.
And along that same line, have you found that there's a barrier with them being at government locations versus trying to find a partner, a private partner in the community to put those boxes?
I haven't seen any barriers as of yet. And I know that, in other counties, this is a strategy that others have implemented with great success, to be able to put those distribution boxes. And the goal is really to saturate the county with enough boxes and doses of Narcan so that if someone has opioid poisoning, that someone's around with a first aid kit or has it in their car or their bag that they can help. So it's really about saturation.
Thank you. Any other questions or comments? Seeing none, thank you for your report and all the work that you do.
Thank you all for your time and all of your support.
Absolutely. All right. Audrey, anything else for the ACE
That
report?
concludes my report.
All right. Thank you so much. Moving into the discussion items. The first one is 7A, presentation or discussion of emergency medical services hiring in order to implement a fourth shift. I believe it says Donna Owenby, the director of EMS, and Karen Morris.
Come on down.
Come on down.
Come on down.
Thank you for being here, and thanks for the update as well.
Well, we appreciate being here, members of County Council. It's an honor to bring to you what we're planning on doing with our 2472, where we're at, and all the work. This project is very near and dear to me and Karen because we work on it diligently when people don't know we're working on it, because it means a lot to us. So we're going to have a brief. Did you do the PowerPoint, and then we'll be glad to answer any questions that you may have about what we're doing and how we're doing it. Okay, this is how our implementation is going to be January of 2026. That's our goal, to get a 24/72 shift up and running. This all began, as you can see, June of 2025 and October. In that period, we hired 17 EMTs and paramedics. 10 were EMTs, 7 were paramedics. We're hiring an additional 5 at this point, and every day it changes. So this is like, it's in motion. We have interviews again, tomorrow? So we'll see how it goes. This was a hiring period of approximately 125 days. Compared to the year before, it's amazing. So the application status, following the advertisement, which began all of this in the 24/72 schedule, is the EMTs were increased by 43%, but the paramedics, which is what you're really seeking, is the 233% increase. And the previous year, we probably had one paramedic?
We had one paramedic
who didn't stay.
for 12 months prior to being able to put the advertisement out there that we're moving to this shift. So what we projected the shift would do, it did immediately, was it began to bring those applications in for those paramedics. It doesn't mean that every one of them, would be willing to come. It doesn't mean that everyone would be, the right fit for this community. But boy, does it give you a whole lot more to work with.
The reasons that people declined the offer of employment were, number one reason, the cost of living in Beaufort County. And of course, you tie that into absolutely the salaries. And that's something people have to think about when they want to move to Beaufort County. It's a beautiful place to live, absolutely, but it is very expensive to live here. Unfortunately, for some people, they have trouble affording that. The number 3 challenge we found was they changed their mind about moving to a new location. You're coming from another state, you think about it, and it's like, well, maybe I'm not ready to move across state and start a new life. And then there was always the fact that some people took a position elsewhere. Were a few little things that people didn't answer after we talked to them, but there were different reasons why, you say, 30 paramedic applications, let's hire them all. Well, it doesn't work that easily, obviously. Some you have to, because we want to be good stewards of the county tax dollars. I don't want to just hire everybody so that in 3 months they're gone. And now I've got to train them again, uniform them again, and all the cost and expense that goes with that.
And we do ask, so when we say these decline the offer of employment, these were people that we interviewed. We went through that process of checking their employment history, looking at their references that they gave us, had the interviews, and these were people that we wanted to hire, and we extended that offer to them. Got all the way to that point to where they wanted the position and then came back and said, so we have tried to do some things on our end to help offset with some of this. Laurel Bay has worked with us to help with some of the housing situations, but they only have so much, they can offer out there. We have put together, we have a great person in our social media department who has helped put together packets for people who are moving here from other places, where we've talked to the apartment complexes to see do they do anything particular for first responders. So we're trying to, tackle some of that on our own, but that cost of living has cost us quite a few of these, 10.
And they see it's a beautiful place to live, but then you start thinking about the cost and living in Beaufort County. Like Karen said, Laurel Bay Housing was wonderful because they gave a great opportunity, but there was only so many openings, and we've already filled that with what we could provide. But it's also, like she was saying, they put together a packet so people would see that the beaches, where the stores are, some of the better things that Beaufort County brings in to attract you. Trying to think about those, think about how beautiful this county is to live in. And some took it, and unfortunately, we couldn't get everybody to take that offer. So we have 130 total funded staff positions. At this point, we have 11 admin staff, which are completely filled. 108 responders required for our 4 shifts would be 27 per shift, 11 part-time EMTs or paramedics. And so out of the 64 paramedics, we have 11 vacancies. 44 EMTs, we have 2 vacancies, which some of that may be filled tomorrow after interviews, possibly. So that's where we're at with that. Any questions? We'd be glad to answer, tell you anything we didn't tell you.
I have a question.
Yeah.
Anybody? So how many declined employment after you went through the whole process?
10.
How many?
10.
10. And are they required to live in the county, like the sheriff?
We have people, we have them that live all over, they live in Savannah,
Hampton,
Yeah,
Pelican,
Hardinville.
everywhere.
Yes, ma'am.
Okay.
Jasper.
As long as they can get to work on time.
Yep.
That's all we care about.
Yeah.
Yes, ma'am.
Absolutely.
And is our salary not competitive, or?
It's not, the salary it's the cost of living that
Right.
makes the salary. Because
Okay.
when the salary's posted, we don't spring that on anyone. When we do our advertisement, it's there. You know what your salary is before you ever apply. It is when they start looking,
Into the cost.
what the apartment is
To
gonna
live
be.
there.
Yeah, a 2-bedroom apartment here can cost you $2,500 a month,
No,
And that's just a simple,
Right.
yeah.
Well, that's why I asked if we don't require them to live in
No,
the
absolutely
county.
not. We just
They can go to
require them come
Hardyville,
work on time.
Ridgeland. Yeah,
Yes, ma'am.
okay.
Well, I think Joe.
Yeah, my question was answered.
Oh,
Okay.
okay.
Yeah, thank you.
Was next.
Sure.
What percentage of applicants were local?
There were a good many,
Yeah.
Good biddy?
a good many were local. We have rehired a couple that had worked for us previously. We've hired from as far away as Illinois, one from Texas, but local. There's been a handful of local. Most all of the paramedics that are local already work for us, unless they happen to be, fire, and they don't have a paramedic, and we've not taken any of those.
We
pulled a lot in from other places.
I just saw an article. I can't remember what it was, but it had something to do with the Beaufort Memorial Hospital and their training. Were you able to piggyback on some of those graduates that came out of that school?
So they have to be able to work as a paramedic or an EMT. You have to hold national registry, and you have to hold South Carolina credentials as a paramedic or an EMT. We don't cross lines.
And they allowed, theirs weren't.
Yeah.
And you have to be certified to ride in our truck. Where on some jobs, you can go start in an office and work your way out or get your certification later. It doesn't work like that for EMS.
Yeah,
Is there something
you know
that?
I think you used to be.
So you're looking for somebody who's already?
Joe was.
That's right. Dawson.
Mr. Dawson was a paramedic.
I'm sorry, I missed all that.
I think Mr. Dawson used to be
A paramedic.
Yes, sir. So that's why I was trying to talk about the credentialing process.
So my question is that on the local level for training, are there any effort being made or initiated
salary?
You or somebody to train people for
Well,
these
we,
positions?
we have an agreement with, well, we work with ACE out there for they have a EMT class.
Mhm.
And we go out there and help there with Jennifer on her class. And then we'll do a presentation to see if there's people who are actually interested. And we have actually hired a few people fresh out of the ACE school, and they came to work for us as EMTs.
And the technical college,
Right.
they're constantly, as soon as one class ends at technical
It'd
college.
be good. I'd be
they're
good to
running
know. I understand going outside, but it'd be good to know the effort that are being made just for employment locally,
up. Yes, sir.
and encouraging the technical college, and encouraging the university to train or to get people ready for these jobs. I think if you have local folks, you're not going to run into a whole lot of problem that
Yes,
you're
sir.
facing.
Yes, sir. We agree with that. The Beaufort Memorial and Beaufort County EMS nearly compete for the same type of employees. While the industries are related to one another, Beaufort Memorial and the technical college are training folks in nursing, nursing staff, and radiologists, which is a little bit different from paramedic training. So the two are the same type of people we're looking for, but competing interests. One thing that you will see in next year's budget coming from Beaufort County EMS is a push for training budget in order for us to be able to promote some of our own EMTs into the paramedic program so that we can homegrown our own EMTs and advance them to paramedic class.
Thank you,
It's a
sir.
very expensive process, but it's important for us to recognize what we have inside and create our own paramedics. So you'll be seeing that coming up in our
Because
next
there is a
budget.
national shortage of paramedics,
Mhm.
not just here in South Carolina, it's every state. And so that's why Karen and I discussed, and we were like, let's homegrown them. They're EMTs for us now. We got, what, almost 7 want to go to
Okay, 7
paramedic
ready
school?
to go. And you have to, the schools have to be accredited,
Right.
to run the paramedic program. So, we use Love Country Regional EMS out of Walterboro. They do an excellent program. And when the medics come out, they're pretty much street ready. It doesn't take me very long to get them out in the field. And we have 7 ready to go. They're starting A&P in January, and then in March it will roll into paramedic. So we've got 7 of them lined up.
So that's what you have to do. You have to bring like you're talking about, the ones that are from within, and we know them, and then we make it as easy for them to go to school. Because a lot of times, the reason people want to go to paramedic school, it's almost 2 years. And it's a lot of work, and it's a lot of time away from family and home. So we've come up with as much as we can to help these people so they can not miss so much home time, but still be able to go to school and advance themselves to a paramedic. It's a difficult class, and you got to be national register, and you got to pass it.
Mr. Belson?
In your effort to get this fourth ship up and running in 2026, I see you say you reduced the number of part-time employees. Are they EMTs and paramedics?
We took those positions and we added them to our 4th shift. So next year when I'm trying to budget, it'll make it a lot easier. But yes, we're trying to go more to full-time people, but we do want to keep some part-time people because it's like we're talking about going to class. I need those EMTs to cover somebody to go to class without having to go into a lot of overtime and stuff. So that's, yes, absolutely.
That was my concern as to whether you're using those part-times and converting them to full-time.
We try to get them, but if they allow them out part-time because they got a position someplace else, we'll fine.
Okay.
All right, any other questions? I do have one question. Do we have a recruiting effort being made with the bases around here with the Marine Corps and the United States Navy? Get the corpsmen? So the South Carolina EMS Association, they're kind of like the umbrella for everything EMS, and they have a huge recruiting program. I don't know if they've caught any of it, but they're constantly doing things. So whether it is, in person, there's a lot of social media. I wish y'all could see some of the social media.
Hope some of you've seen that on
I hope
Facebook,
I
our
have.
commercials. They're pretty cute.
But yeah, there's all different kind of ways of reaching people. There's no one way, and we are tackling it from, I'm telling you, 3 o'clock in the morning, I'm laying there thinking about the stress and trying to get this, because it does not affect me personally. It affects every person on those trucks. And y'all can hear those sirens going up and down this road all the time. And they are working as hard as they can, and we want to get this shift going. So we're tackling it from every way we can think of. And yes, we have some former military. There's a big program, to help bring the corpsmen in. National Registry has put an easier program to help them slide from military to civilian. So yeah, there's a lot.
And last question, is there a prohibition on hiring firefighters or a hesitation to do so?
Absolutely not.
Because I've heard that in the community.
Oh, no.
No, we wouldn't go out trying to recruit them
Yeah.
away from the
I
fire
won't
department.
take their firefighter.
But if they report to the EMS, a matter of fact, we hired 2 fairly recently, and one of them just decided that EMS wasn't.
He'd rather stay a
And
firefighter.
he went back to
And that's
fire.
fine. And I've lost a paramedic to a fire department, and that's okay because you're gonna, you gotta really want to do what you're doing. So if you're happy you're a firefighter, okay. But if you want to come with EMS, come on board. We're down here. But we do a lot of, trust me, thinking outside the box. I think even HR was impressed with some of the things that we came up with. Karen's on the board with the EMS Association. I'm on the Low Country Board Regional for EMS. So anytime we can get that word out, we get it out. And we want the best of the best and keep the reputation that Beaufort County, because that was one of the things that Karen did learn when she was talking to people in orientation. We have a reputation for being the best. And that's important.
We asked, why are you seeking employment with Beaufort County? That's just Beaufort County EMS's question. We ask everyone that interviews. The number one answer is the 2472. It doesn't matter whether they're EMT or a paramedic. That is the number one answer. And number 2, it didn't surprise me, I'll admit it. It was the professionalism and what they had heard about Beaufort County EMS. You've got good equipment, you pay well, y'all have a good, foundation, a good training program. So that was number 2.
And things that we also hear is because people go through, I call her the little general, she'll put them through the 40-hour orientation program, and they'll come out of there and say it's one of the best orientation programs they've ever come across, because a lot of places will hire you. Here's 2 days, get on a truck and go out and run. They have to pass the Karen inspection and make sure that they are par for that truck and know what they're supposed to know equipment wise and everything else, rules and regs. But that's what you want. You want somebody that makes sure that your county is representing you well and don't have to worry about them doing things that they're not supposed to. Are we perfect? Absolutely not. But we do our best to make sure that they are well trained when they go out there. And if there's any issues that they feel uncomfortable with, they know they can come to me. They know they can go to Karen and say, they're not going to get in trouble because they don't know something or equipment or whatever. They're going to learn, because that's what we want. We want you to learn and know what you're doing.
Sorry, Mr. Dawson.
To follow up on a question that was asked earlier about the reason we're having some go through the program and then decline being hired was because of the cost of living and salary. And so our salaries are comparable to the region.
I think I think that you mentioned, if you don't live in Beaufort County, let's say maybe you live in Hampton, that salary maybe goes a little further. It is trying to live here in Beaufort with that salary. That's when, so if someone is moving, let's say from Illinois, and they're looking at an apartment, and they're looking in Beaufort because they're moving to Beaufort. That's all they know is I'm going to Beaufort County EMS, so they may not realize, they could live outside the area. So that's information that we do give them. Because like I said, there's no rule on where you have to live at. You just have to work on time.
But our number one issue is the cost of living.
Yes,
The
sir.
cost of living, the very first thing we mentioned.
And the reason I asked that is because we as council, we're struggling trying to build what we call affordable housing. And with all the growth and development that we've had over the years, we're not addressing the cost of living to make the housing affordable for residents and people who want to move to Beaufort County. And so I think we need to focus. Going forward, we need to focus on actually building affordable housing, call it whatever you want, but it's got to be to the point where people like this on the entry level, EMTs and paramedics, can afford to live here in Beaufort County. We got to address that.
What's an entry level EMT make?
56.
56, okay. My other comment was, this is a great opportunity to congratulate all of your staff, all the firefighters, all the deputies, everyone that showed up to the mass event.
Oh,
So, I mean,
The what?
I know it was a huge event, a huge night.
So we had out St. Helena.
The shooting event.
Oh.
And all of you were there, and I mean, there were a lot of posts on Facebook, how great all of you were, how great the firefighters were, deputies, and so it's our opportunity to thank you for that.
Well, we appreciate that. And there, you can say one thing about this county. Police, fire, EMS, we work together. When we have to come together, we come together. And that night, I mean, I think I got home at 5 o'clock in the morning, but there was everybody, including the hospital, working together and I mean,
Yes.
pulling and doing things right. And I mean, law enforcement was first on. They were doing a wonderful job. Fire was wonderful. And then my people were professional and they actually were going in and taking charge and saying, okay, this is how you do a mass casualty, because not many people get to use being around a mass casualty, and it is treated differently than a lot of times other things. But yeah, thank you for that, because we do appreciate the job that they did out that night, and everybody did an excellent job. Everybody.
Congrats to the fire department and the sheriff,
Oh, yeah.
everybody. All our first responders.
It's probably, you look at those of us that work for EMS and you probably think, oh, obviously you would say that. But I go all over the state with the South Carolina EMS Association. I talk to all different people from all different departments. And I can tell you this and sleep easy at night, telling you this, that we have an excellent EMS agency here. We've got some of the best fire departments and the law enforcement top shelf. We really do have that. Work hard to keep it that way.
Good.
All right. Thank you so much for the update.
Yeah. Thank you.
Appreciate it.
I
All right,
also
thank
want to thank you,
I
too.
think everybody's good. Thank you so much for the update.
Thank you for coming.
All right, moving into discussion item 7B, presentation and discussion concerning progress towards the solicitation of a fire service consolidation study. John, the floor is yours.
All right, thank you so much. All right, so this, the fire service or fire department consolidation study was inspired through strategic planning process, and it was direction from committee and council to the administrator to fund this in this budget year and then commence doing this study. So this, the study was funded in this year. The county administrator asked me to begin working on this project. So as part of that project, I reached out to fire chiefs and to EMS, to all of our public safety directors, and we began discussing the issue at hand. It was very important for me to make sure that all of our stakeholders had a voice at the table and that we listened carefully to and tried to combine, understand each of their needs, some of their history, and combine them into the options for the scope of work that was in your backup material and it's on the screen. So before I get to that, what I'd like to do is talk about the complex nature of fire service consolidation, what's been done in the past, so you understand some of the history, what we've done to date, and then we'll talk about the scope of work options and give you our recommendations for which of those items in the list of scope of work we should prioritize immediately. And then we can talk and answer questions. And of course, I'd like to recognize all the fire chiefs in the room and their support as we've worked on this project. It's so important for us to make sure that that we hear from the professionals that have been doing this work for many, many years and understand their concerns and their the positives and negatives that come along with this type of work. So the brief history. As far as I can tell, and there's probably some older than this, there was a fire safety consolidation study that was conducted by Mizell Hodges and Associates in 1990. So this discussion of fire safety consolidation has extended more than 3 decades. This, the inspiration for this study was the hurricane just the year before, Hurricane Hugo. During that hurricane, there was not really consolidation of fire departments at that point, but a group of fire departments that had to work together, and all of public safety that had to work together in order to evacuate the citizens of Beaufort County. We were very lucky that the storm went a little north of us, but yet the group of public safety began to recognize how important teamwork and working together was at that time. The results of that study mostly focused on ISO, and ISO is the insurance. Oh my goodness.
Rating.
I'm trying to think. Insurance Services Organization. So it is essentially an insurance risk assessment for each community, and that public safety's ability to mitigate those risks. So it really looked at each organization and what they could provide and how we could improve our response to those risks in as it had to do with the response to Hurricane Hugo. After that, there was a paper in 1997 written by the public safety assistant county administrator. Then his name was Randy Wood. So Randy wrote a very good paper that talked about the benefits of consolidation and left a roadmap for future consolidation that, although it's from 1997, it's a very good paper. It was very well written and does really lay the roadmap for that. And it did, even in that paper, it referenced the 1997 work. In between 2001 and 2004, there was a grassroots effort. Between the Burton Fire District, the city of Beaufort, and the town of Port Royal. And this was what they called then the Port Royal Island consolidation attempt. This was the closest that I can recall or have knowledge of that any two departments in Beaufort County, well, I can't say that quite, that any modern departments came to consolidation. There has been some consolidation on Ladies Island. There were two departments there, Ladies Island and St. Helena departments, who were volunteer, and they joined together. And now the town of Port Royal and the city of Beaufort are essentially one type of organization as well. And there's some other examples on Hilton Head, Sea Pines, and that kind of thing. But a global consolidation, this work that was done by Chief Roundtree and Chief Wendell Welburn back then was probably the closest to almost getting to that consolidation. Follow that in 2011, there was an EMS study, which was a fire support analysis study that also looked at some consolidation efforts or improvements in the EMS system and had some discussion about consolidation at that point. So right now there are 8 independent fire departments, not including military fire departments, within Beaufort County, and 1 single countywide EMS agency. Beaufort County EMS provides that transport, advanced life support for everywhere in Beaufort County, with the exception of Hilton Head Island. Hilton Head Island is a municipal operated department, which provide their own fire-based EMS support, right? So while each of the above-mentioned studies discuss the potential that's created by consolidation of departments, they all agree that consolidation of fire departments must happen prior to any inclusion of EMS, because EMS is already that consolidated system throughout the county, with the exception of that one. To do anything different would fracture the responsibility of EMS. And each of them, while we have done all these studies, some of them have inspired some change within organizations, some improvements in ISO, some improvements in equipment and quality, procedures, and those types of things. None of them have resulted in any significant effort towards consolidation, not from with the county's involvement. And each of them boils down to money. Does the effort outweigh the cost? And when we talk about cost, it is equitable distribution of those dollars. So we'll talk about that a little bit. Part of the process. So that's a little bit of history. There are pages and pages and pages of information. And I'm sure if you want to sit down with Chief Klein, there he is. He has studied this for years. Chief Klein, how long have you been a fire chief in Beaufort County? Since 1994. 1994. All right. So I would venture to say that Every firefighter at some point in their career has heard the word in Beaufort County consolidation and had their own thoughts and made some effort for or against that. It is rare to find someone with as many years of that experience under their belt as a chief client, and made significant efforts in that direction as well. So as part of this process, I began by meeting with all the fire chiefs. We all came in the room together. It was a nice, safe space. I put it on the table. Here's the work that I'm doing. Start swinging. And we had an open conversation. We talked about each of their concerns. We tried to, and it was probably 2 hours or so, we tried to boil those down those concerns and begin to work on what I shared with you, the scope of work outlined. Those things those conversations, each of those rabbit holes that we could boil down into an actionable item that we could work towards. I also followed that up with independent conversations with each of the fire chiefs, one-on-one, sometimes sitting in their office with coffee, sometimes over the phone, sometimes email or written back and forth. I just wanted to make sure that I was properly representing each of the organizations and their concerns, and they're all different. So one thing that is unique about Beaufort County is that it is different from most other places. There are examples of fire service and public safety consolidations all over the state and all over the nation. What makes Beaufort County unique is the natural transitions that we have, bridges and islands that created these organizations and taxing districts that make fire service in those specific areas important to those areas. When we look at I'll talk about Ladies Island because it's a nice little island and it's got island in its name. The Ladies Island Fire District itself is isolated in a way by bridges, and over time, that taxing district has become self-supporting on its own. The benefit of consolidation could be increased resiliency from those areas. Yet, we still have to make sure we understand that we have natural boundaries that separate these areas. All right, so we had lots of that discussion. So we developed this list of items and have some recommendations to go forward for this scope of work. While on the list that you have, that's on the board, and I have some extra copies if you would like them. Does anyone have one or would like one? So I highlighted a few here just for you. That's right.
You said we get out of here, right?
Oh, I don't have your highlighted.
Thank you.
See if the same one's
Let me see your highlighted copy. Okay.
So that information was in your backup material. But these are the objectives of the scope of work that we came up with collectively. There are 13 of them. I think number 7 and number 13 are nearly the same. So we had lots of discussion about lots of different areas: cost analysis, financial obligations, service demand and standards, ISO ratings, compensation and benefits, policies and procedures. Much of this work can be done by the experts in the room today. And I'm not talking about me. I'm talking about the row of fire chiefs behind me. We have the talent and the expertise here. The biggest hurdle that we have to leap, and it's evidenced by all these reports from almost 30 years, is how do we fund this properly? How do we share in this service equitably across the county? As we move forward, the ones that I've highlighted for you, I guess what I'm seeking today is your input on what we put out to bid for the consolidation study. The primary ones are what I've highlighted, and the rest I can put out for bid as alternatives. So I can have folks bid on them and give us an a la carte price, and we can choose to do it or not. The first is the cost analysis, to establish the total cost of service for all the participating agencies, to compare the current cost of residential, commercial, and non-residential fire service delivery to the projected cost of the consolidated system. In other words, what are the taxes going to look like? How much is it going to cost you as a resident versus what it costs you today? What will it cost you tomorrow? What are the financial obligations of each of the organizations? We have debt service to consider. We have agreements between different organizations to provide service to one another that's outside of an automatic aid or a mutual aid agreement, financial agreements, and that will have an impact as well. Service demand and standards. This is to ask to determine the minimum level of service based on expectations of the community. So that is a key factor when we determine cost. We first have to understand what is the expectations of folks in the community for that service delivery, and then how do we meet that. Then ISO rating impacts. This is one that honestly will work itself out. The fire chiefs will understand how that works. Every one of them have been involved with ISO well back into the 70s and 80s. That's not something we need to pay a consultant to do for us. Number 5, so far the ones I have highlighted are number 1, number 2, number 3, and number 5. So number 5 is compensation and benefits. This is to review and assess the difference in wages, benefits, and retirement plans among participating agencies. That's going to be where a lot of cost comes in. Just benefits alone when it comes to compensation and salaries, and bringing all of these agencies into a county type of benefit plan will be costly. Something else that's very important for us is number 7, legal and administrative structure. This is to define the necessary legal governance and management structures, including intergovernmental agreements, contracts, to support that potential consolidation. Number 13 is very similar, but it specifically talks about analyzing enabling legislation for each of the organizations and determine that course of action for consolidation. Because some of our agencies are county enabled or county established agencies. Some are state, have state enabling legislations, and other are public or private PSDs. So there becomes some things to discuss there. Before I open it for questions, I'd like to make sure that we address the difference between urban and rural services. When we talk about money, urban services or an urban level of services requires the density of population to generate the tax dollars in revenues to support that urban level of service. As we go into rural areas, the number of folks or the population and density in that area supports currently the system and public safety that's provided. When we consolidate departments and we mix urban and rural, there will be an inequity in cost of that service. Someone's got to pay for an increase in level of service. We're asking that a consultant look at that for us, determine what that looks like, and help us understand what is the hurdle we need to get over to achieve that. If we find that the report from this study comes back and there is a palatable response to that, there's opportunity then for us to put our team of fire chiefs back together, take this piece of knowledge that we can move forward, and begin to solve the rest of the problems moving forward. So that's our goal for today. Ask you if you agree with the scope of work that we presented. Ask you if you agree with the highlighted items there. And if so, then we will list those as the primary and the balance as alternatives.
Before I open it up to questions, I got one for you. I know this is discussion only, but are you asking for an action item on this?
Well, we can't ask for an action item, but if you look at me and you're saying that you agree, you think this is the right path forward, I can take that as understanding that that
put-
you
and put
agree.
together the
So,
RFP.
so no vote because it is only discussion.
Okay. That was the clarification I wanted. All
Yes,
right.
sir.
Any questions? Yeah, I'll start down here. Ms. Glover.
There's lots of fire chiefs here that are ready to answer questions and may have comments as well.
Sure.
We see them all there. Mhm.
My question would be, what's the driving force behind consolidation?
Yes, sir. So right now, two main factors. Two main factors are what we discussed a few moments ago about the natural barriers or the natural defining response areas. Most of Beaufort County is isolated by bridges and small islands, but there comes a point when municipalities begin to annex into the county property into non-municipal properties that leaves behind donut holes, where the unincorporated or PSD type fire department still has a responsibility to respond because there are still non-municipal properties that have to be protected. However, the highest value property that previously was tax dollars going to that entity, those tax dollars now go to that municipal organization, and they leave behind less dollars in the unincorporated or PSD type fire department and make it more difficult for them to provide service. So in a way, a consolidation between those organizations erases that line. These organizations all are funded from the same source and there is no competition. In other words, annexation cannot fracture fire department service any longer. That's a very valuable thing. One of the other topics was from Ms. Tabernik, and this was to look at normalization of compensation across the districts. As we look at the salaries and compensation for firefighters in an urban setting, it is comparable, but not comparable to that compensation of a firefighter in an urban area or in a rural area. The difference is at risk. Again, firefighters in that urban area, they have more funds, they have more people per square mile or per acre than the rural area. So while the risk of a singular house fire is the same to a firefighter, the frequency of those house fires is much different. In the city of Beaufort or town of Port Royal, for instance, or even in Bluffton, an apartment complex can have between 75 and 300 apartments. If the average home has 4 people in it with 300 apartments, there's 1,200 risks of people, right? And every toaster and every microwave and every heater and every hair curling iron and every source of fire versus a rural area, which is 1 home per 3 acres and probably that same number of 4 people that live there. The risk of frequency of that fire is much less reduced. So the independent risk that firefighters still exist if they all go to the same fire, but the number of fires or number of risks they put themselves at are different. So you see there's a difference in compensation for someone working in a more urban area versus someone that's working in a more rural area. I don't know if that's helpful or not.
Well, what you have said to me is that in my rural district that I represent, there's really not a need for us to look at consolidation.
Well,
I'm just going to
sir,
share that with you. You asked for my opinion, so
Yes,
I'll
sir.
give it to you. Yet I serve also the inner city of Beaufort as well, and there's a need for maybe better fire service there. I'm not too sure because the municipality handles the fire district in the city of Beaufort, but on the rural area, Ladies Island, St. Helena, even though annexation has occurred, there's a relationship between the city of Beaufort and the Ladies Island, St. Helena Fire District to service those areas, those donut hole areas that the city is not actually covering right now. So it's being covered. So I'm just wondering, what's going to convince me that we need to spend more money on a plan?
Well,
That's where I am.
Yes, sir, you're not
Okay.
wrong.
Okay.
As I stated in the beginning, the complex nature of this is very deep.
And I'm expressing
Yes,
me but I would think that other areas may need consolidation. So I need to be convinced that this is the path we need to pursue.
Yes, sir.
Thank you, sir.
Yes, Joe.
This is a study that is long overdue. We've been talking about this for many, many years. Our fire chiefs are aware of what's going on. I think you've put together a very comprehensive scope of work. You're going to target certain people that do this for a living. So it's a twofold question. When you put it out, do you have some sense of what it's going to cost to do such a study?
Yes, sir. If we limit the primary questions of the scope of work, right now we have budgeted, and it's in council's budget, is $100,000 for this study. We looked at several other studies conducted, and based on that limited amount, we should be able to afford that much of the study. If we included all of those items, that's probably a much more expensive study that we're not prepared.
Okay. You get what you pay for.
Yes, sir.
So if we're going to do a study and we're going to hamper ourselves, we may well not get what we really need. So I would personally like to see a study that has these as the basis and the others as alternatives.
Yes, sir.
Because a company who does this for a living may say, by the way, taking a look at where you are, you really need to do this.
Yes, sir. That's very likely. So the intent is that we put this scope of work out for bid, and we bring in companies that present themselves and present those opportunities. And you are very right. We may find that a company says, you can do all these things, but if you don't do this, you're not getting the right thing. And we are certainly open to that.
All right. So I believe we should move forward with this.
Thank you.
Okay.
Yes, Mr. Dawson.
John, as you said earlier, consolidation of the fire services, it is a complex issue. You alluded to the fact that in 2011, somewhere around there was a study done. And Chief Klein and all the fire chiefs were actually partakers in that study as well.
Yes, sir.
And the primary issue is trying to consolidate all of the fire department is the disparity in the geographical areas. That's what they found out, right, Chief? That's what they found out. And if you have the disparity in the geographical area and you try to combine the fire districts, then you're going to have inequity in the level of service provided for the populated area versus the rural area. And that's going to be an issue. And so the inequity of the cost of fire service in the rural area is not going to be what's needed in the more dense area. And so now when the taxes go up for fire service combined for the county as a whole, the folks in the rural area will be compensating fire service in the larger areas. And so I'm curious to see what this will be the second as far as my tenure on council. This will be the second consultation study that we'll be doing. But I'm curious to see what it's going to render as well. So I can support moving forward and just seeing what it presents to us. Not that I'm going to support it. Thank you.
All right, Tab.
So I do have your previous paper, and what I really liked is it says, what's in the best interest of the people we serve and our employees. So that is why I raised it. A firefighter in Burton may not have the same benefits or make as much as Bluffton Township, which is where I live. And I get it, a mill in Bluffton Township, 1,200,000 maybe, Ladies Island, whatever it is. So my question is, before we jump into this study, looking at the ones you highlighted, those could literally be discussed and done in-house. It's basically the cost analysis could be done with the chiefs, yourself, our finance CFO, I don't think we need somebody to do that. I took the 5 budgets and I could easily see that if we put these together, the millage goes up across the board. I get it. But that would be a starting point. And looking at financial obligations, these chiefs all know that. You know that. Pinky knows that. Looking at service demand and standards, they clearly have it. Do we have 3 on a truck, 2 on a truck? I don't know. Compensation and benefits. So number 1, 2, 3, and 5, I'm wondering why we don't do that in-house first and then get a consultant and also look at other counties that have consolidated. I know there are issues here, but some of this could be done in-house. If it's absolutely off the chart, then why would we drop $100,000 to do it? Other than in this paper, it said, I really like whoever wrote this. He says, it's time to quit kicking the can down the road and get on it.
That was 1997.
Yeah, 1997.
That was
That's
a
what he said.
Randy Wood report.
And he said, it's not wrong to not consolidate. It is wrong to not consider consolidation and stop kicking the can down the road. So my question is number 1, 2, 3, and 5. Why couldn't the chiefs and you, and I'm sure they have other things to do, but they know it best. They live this every day, and put Pinky in the mix, finance in the mix. You could put you, Mike. You can do 1, 2, 3, and 5 without even dropping 100,000. Then I think where the consultant comes in is, what have other counties done? What do you suggest using our data? So I was looking, I hate to sound cheap about it, but these guys know better than some consultant that's going to walk in the door.
Yeah, I agree.
And Chief Klein's getting ready to say something, I think.
Certainly. I do not disagree with you, and I do believe the talent is in the room to make this happen. But this is the direction that came from council, was to come forward with a study, and that's what we do. We follow that direction.
Well, we did ask for a study, but it
You
could
did.
be generated by the people who know it best. That's my point.
I don't disagree with what Ms. Tabernik said, but one that was not highlighted, I think should be, or we're gonna be here, somebody's gonna be here 10 years again, is the implementation plan.
Is the
And
implementation,
going back to
absolutely.
what Randy Wood said, back in 97, that's gotta be, something put on paper about implementation.
Absolutely. And I will say that the prior work that was done between Chief Harry Roundtree, the Burton Fire District, and Wendell Welborn was so close. And they did all of this work between 3 fire departments. They did all of the financial study. They did all of the personnel, the organization, all of the legal work. They did every bit of it. So
what
it can be done.
So what happened?
I don't think we want to talk about that here.
No.
That's a long story, and it was a
Okay.
long time ago. We have the opportunity right now to do something new. When I go back and I look at the history of the 1990 report, I look at what Randy said in 1997, which is still very good work. Organizations have changed since 1990. In 1990, the Bluffton Fire District had 3 fire departments. Now they have 11 and building 12 and looking at 13. And they are amongst the largest fire departments that, well, I don't know about the state, but they're a very large organization. In 1990, the city of Beaufort, not combined with Port Royal, but the city of Beaufort alone had the most paid firefighters. That does not exist anymore. So things have changed significantly in the past 30 years, and it's important that we take a look again, because like Randy said, the only thing we could do wrong is nothing.
Mr. Reitz?
The only thing I want to add is that with all the changes, we've had one constant. Chief Klein, you've been here 30 years, or since 1990, correct?
40.
Well, 40, thank you. My thought is, why don't we consider what the chiefs want? Have we thought about that? Have we talked to you? I mean, have we, in this backup, I don't see any of that.
Oh, it's there.
Is it there?
But
Okay,
that's why all the
but
chiefs
my
are
thing
here.
is, please,
So if
you
you
know.
want to ask them the opportunity to speak, I'm sure they are prepared.
And Chief
he's
Klein,
prepared.
yeah, I see you jumping out of your seat if you want to come on up.
And
He's
I
got
come
his
at,
notepad.
good stewards of the money here. I think we have some experts that can.
Yes, sir.
guide us.
And good afternoon, council members. And I'm going to echo some of the things that you said, but I have some thoughts and opinions that I have shared with John. And I think overall, he did a decent job of covering those. And it was just stated, first and foremost, I think that the talents in the room, fire chiefs, Mr. Robinson, Pinky with finance, to really do a thorough look at what are the impacts to the taxpayer. At what cost, and who pays that? And we can run those scenarios, and we can put up fences. You know, if you throw the presentation back up, it says countywide. Are we truly looking at countywide? Because I think there's somebody absent here today. It's Town of Hilton Head, and they want no part of this.
Oh?
Okay? They have a robust organization. They're a fire-based EMS. They're in the range of $23 to $24 million is their organization. I think the Town of Hilton Head doesn't want any part of this, and that fire chief stated that in our first meeting. Okay? So I think there are scenarios, no matter where we put this funding fence up, there are several scenarios that we can look at and give you a very close estimate of what the impact is to the taxpayer. Again, I say, who's paying what, and who ends up paying that bill. You could look at it subsidizing. The big hitter in the room, Bluffton Fire District. Over $1 million mill value. In the fire service, the next closest one is Ladies Island Secondary Fire District at $217,000. So when we start looking at fences and what this looks like, are Bluffton citizens prepared to pay an additional 8, 9 mils? I don't think so. But I think we should run those scenarios. I think we should look at those things. I think that it can be done by your fire chiefs, by finance, and John. Look at all the potential scenarios. We know our budgets. We know our mill rates. We know our mill values. We know the needs of the citizens in our communities. We work on that every day. We're trying to provide those increased level of services. The scope of work I somewhat disagree with, and I did state this to John in my email, way too broad, way too involved. You are never going to get a consultant for $100,000. Mr. Passant said it, you get what you pay for. That's exactly what we'll get. I think we need to look at this, the analysis of what the cost of service is, and then go from there. So what I'm asking you to do is pump brakes a little bit. I'm not saying kick it down the road another 10 years. I'm saying pump the brakes just a little bit. You know, run back to the cost analysis. I've run some numbers. That's kind of what I do. You know, I know values, I know rates, and I study them. There is a potential for a great reduction in mill rates to some at the cost to others. And I kind of threw it out there already, Bluffton at 8 or 9 mills. Again, my last comment is basically, you know, the fire districts commit their lives to providing a level of service to the citizens that we're sworn to protect. And we constantly look at how we can do that, increased level of service at a better cost. And there is not a fire chief in this room or those that aren't here that has the same opinion. If it is a better level of service or equal to at a better price, we're all in. This is not jurisdictional. This is not territorial. We're all in. You know, you took it down again, but the mission states more than once, mission and purpose and objective state more than once, at a greater value. I question that. I really question that. At a greater value, at whose cost is the question. And I think that you give us a little bit of time, we can figure that out. And we can lay that all out to you and then go from there.
Chief, thank you.
Yes, sir.
Sounds good to me.
Are there any other questions?
No.
I do have just one other comment, Chief. I mean, when I looked at the purpose, I don't think anybody up here questions the countywide level of fire service or the providing effectiveness or greater value, because I know I live in Bluffton. I have absolutely no problem with my Bluffton Fire Department.
You have a great fire service in Bluffton.
Yeah, they literally live in Sun City, so we're okay. But, and I know.
We knew that before they built Sun City when they started talking about it. They were going to live there.
Yeah.
Yeah.
But it also, don't hear complaints from other fire districts, Burton, Sheldon, Ladies Island. I mean, we just don't, so people are satisfied with the service.
I would submit to you that the efficiencies are very good, and within their financial means. Duplication of effort, duplication of services, very, very small area within the county. John referenced Harry Roundtree and Chief Wendell Wilburn. That was looking at combining Burton and Beaufort, town of Port Royal. And so, again, duplication of services, a fire station across the street is a small area. That's not responding to across the street. That can be handled by automatic aid contracts, mutual aid. And, you know, we talk resiliency in the objectives or the purpose. I'll submit to you that the major fire alarm FRIP showed adequate distribution of resources and resiliency. Though FRIP only had one engine, but automatic aid, immediate, and mutual aid put enough people on that scene to keep it from, yes, it burnt 3, could have burnt 7 or more. So that's distribution, that's resiliency, that's adequate resources. Could they use more? Absolutely.
Of course.
But at what cost?
Is automatic aid the same as mutual aid?
No,
You just said
automatic's
both of them.
automatic out the door as soon as the call goes in. We have an automatic aid with the city for downtown Beaufort. They're arguably the heart of Beaufort County.
Okay.
And so if there's a fire call in the city of Beaufort, tones drop for the city of Beaufort and Ladies Island, we respond.
Okay.
While I know we're not taking a vote, yes, Joe.
So if I hear you correctly.
Yes, sir.
It is your preference to do an in-house study.
Yes, sir.
Before we would consider saying, okay, based upon this, we need the next step.
Yes, sir.
Right.
And I say, I think the Madam Vice Chair brought up, 1 through whatever. She scrolled it up a little bit. I tell you, I think we can handle the cost analysis and the financial impact. We know our debt. We know our restrictions. We know what it's for. We know when the terms. We know all those things. I don't think you can bring anybody in to tell you cost analysis, financial objectives,
Right.
service levels, and
Yeah,
ISO ratings
you.
better than us.
Right,
Right.
right.
That's like 1 through 5, you guys could do better than a consultant. And you wouldn't charge us $100,000. Oh, maybe.
99, yes,
Okay.
ma'am.
He'll send a bill.
They'll send a bill. Okay.
Well, Joe, you kind of touched on what I was going to say. I know we're not taking a vote right now, but I think the consensus is to work on it internally
Yeah.
and then to come back and we can have further discussion about this.
Absolutely.
And I think we want to address some of the concerns here, but I don't think we want to pay a consultant right now.
Well, that is the purpose, is to make sure that I get a feeling of your desire, and I can take that action.
And I'd like the other chiefs, if they want to speak, Chief Church, yes.
Chief Church needs to talk. Good afternoon, committee members and members of council. One of the things that I would like to consider is essentially what I would like to see as a citizen and as a operating member of the fire district in Bluffton is more of a concentration on interoperability rather than consolidation. Currently speaking, we do a very good job at that on the surface. There are some areas that we've seen just a few dollars or a little bit of cost causes a hiccup in the service that should be provided. I'll give an example. Hardyville has annexed Cracker Barrel in Bluffton.
Correct.
But if a cardiac arrest call goes out there, Beaufort County EMS is the responding agency, but if our personnel hear that call, they're going because it's a critical call. And, some can say, well, you can afford to do that. It doesn't. If you run the numbers, it's not that many times probably. But one example to look at, and the Fire Chief Hilton had actually brought this up in one of our meetings, is Charleston County and what they're doing with their collaboration and cooperative response and the things they're doing. Everyone always says, Bluffton is being considered the cash cow in this thing. We do have a $1,079,000 mill value. However, we're supporting about 3 times as much as some of the departments in the county. Our call volume's approaching 11,000 calls a year with fire and EMS calls. That's almost the total of all the calls in northern Beaufort County. So I say all that to say that, just things to consider is cost of living that EMS brought up earlier as an issue. If Bluffton gets if Bluffton were to get frozen or slowed down in the progress that we've made throughout our time, and we've been in front of you guys many times to beg and plead for it, I think that we would have a retention issue if that were to happen in any case, countywide even. Do the other departments need to catch up? 100%. We heard that in the budget presentation meetings. That was very clearly identified. What we have today that we didn't have 10 years ago, or even maybe 3-4 years ago, is supportive staff on council, supportive staff administratively, and that's proven in the work that you guys have done and the county has done with the EMS alone, and and the sheriff's office alone, and the pay increases that have occurred, the pay studies that have occurred. I think a lot of that can be fixed district or county-wide with the fire districts, both in all levels, is the continued support. Sometimes there's been questions asked, do you have enough to do what you need to do? And I think the days of, I think the full understanding that emergency services matter and we need them, that's something that AI can't do, is save someone's life.
Right.
It's just the continued support of all the agencies in the room represented, and just knowing that when there's a tax increase that is needed, because they're going to have to, some people are going to have to do that. Growth is helping us. Growth is coming to them at some point, just like it came to us. Chief Roundtree made a perfect example. 1990, we were running one person on the engine, one person on the squad. Maybe 3 employees. And we've grown to where we're at through the process, but we've had a supportive commission on board, and we've been supported through growth. I think that just has to be looked at in general. But just a quick numbers, and something I think would be beneficial for you guys as well, is to look at the share, what exactly is going on in every district call volume-wise. Like I mentioned our numbers earlier, but just a look at the call volume I talked about earlier. I'm sorry. The rent costs. It's about $400 or $500 more a month to live in Bluffton rent-wise, according to the 2020 census data. That's per, that's just what the census data says, versus the north and abroad. Housing units. We protect 33,873 housing units according to the census data. Ladies Island St. Helens at 9,689 and growing rapidly, because they're coming up right behind. They're growing as well. But just one of the things I want to reference, and I'll sit down and let you guys move on with your day, is when we talk about cost of living, even with our increase in salaries that we have versus some of the other agencies, out of 170 employees, we have 55 of them that live out of the area, and 9 of those commute from Georgia. So it's not just it's what's a live, work, play. It's where you live and where you work and where you play is going to contribute to what you need to make. And there's studies on that, and I think that supporting the agencies in their own independent outside agency pay studies will help that factor and probably alleviate a lot of other things. So that's all. Any questions for me?
Appreciate that.
Any questions?
No, thank you.
No?
I think the chief.
We have another chief.
Yeah.
Come
I'll be
on.
real quick. I know y'all got another meeting
You
planned.
don't have to be quick. Go ahead.
I just wanted to add, and John referenced that some of the jurisdictional boundaries. I think we're part of that. The city of Beaufort and town of Port Royal and the Burton Fire District. We can do a better job of automatic aid. There's a long legal history between us that has been going on well before me. And I think a closer unit response, an automatic aid program, and eliminate all those legal issues is the direction we need to move forward to. So I just wanted to add that comment to the discussion.
If it could be that easy, Chief.
Well, I knew.
Okay.
But thank you.
Thank you all.
Thank you.
Is any other questions? I will say one comment, and I am speaking kind of on behalf of everybody here, chiefs, staff. I think you'll find that we want this to be a collaborative process to do what is best. If we just need to analyze the numbers, look at everything and see what we can get to make it right. There are some issues that need to be corrected. What that looks like, we want to have a collaborative process, and we don't want to force anybody to do anything, but we want to have the highest quality service across the board in the entire county if we can. All right, so thank you all for being here, and thank you for your input.
Thank you.
Thank you.
Appreciate it.
All right, now moving into item 8A.
That's a good discussion.
Yeah, the appointment of Justin Palmer to the Disability and Special Needs Board for a 4-year term with the expiration date of November 2029, pending approval by the governor's office.
I'll make the motion, Mr. Chairman.
All right, is there a second?
I'll second.
All right, by show of hands, is there any objection or, well, is there any discussion about this?
No.
Any discussion? No. By show of hands, I believe that is unanimous. Is there any other business to come before this board? Seeing none, this meeting is adjourned.